Before you begin treatment, a consultation and evaluation will be scheduled with the radiation oncologist, who will provide you with information while answering any questions that you may have. On the day of your consultation, our receptionist will inform the nurse of your arrival and will present the physician with any additional information you may have brought with you. You will be asked to complete several forms, which will provide your caregiving team better insight and understanding of your medical history. Not all patients are appropriate candidates for radiation therapy. If the radiation oncologist believes you are a candidate, you and your referring physician will receive a full explanation of the proposed treatment plan. The physician will discuss your diagnosis and the recommended treatment with you and your family, including whether additional tests will be needed. The nurse will provide you with additional information and instructions and will arrange your next appointment. If your recommended treatment involves receiving radiation, a treatment planning session will be necessary using a CT scanner, also called a simulator. A simulator is not an actual treatment machine, but helps us plan your radiation treatment. It is important for the physician to be able to determine exactly where the cancer has developed prior to actual treatment, so that healthy tissues are not treated. This is the fundamental principle of the treatment planning process. Images and measurements from the simulator are then transferred into a sophisticated treatment planning computer, where the optimal radiation angles, shielding, and daily dose are calculated by the dosimetrist and physicist. With your physician, they will establish the best method of delivering the exact dose of radiation to the tumor. Before you start treatment, the plan is transferred from the treatment planning computer to the treatment machine, and the physicist confirms the dose output and distribution as part of our quality and safety program. All of this work may take several days or longer to complete. Once the simulation is complete, you will be given appointment options for your setup day and first treatment. Radiation treatment is a multi-step process. For external beam radiation, the first setup appointment normally takes slightly longer than the regular daily treatments, which are approximately 20 to 30 minutes. This additional time ensures that what was planned during simulation is reproduced exactly. Confirmation x-rays are usually taken on this day, and your actual treatment begins the following day. During your first week of treatment, the radiation oncology nurse will discuss the self-care measures necessary for your comfort and safety during your treatment. Please feel free to ask the nurse questions or request assistance anytime during your visit. Once your radiation treatment is underway, you will arrive for treatment at the same time every day. The total amount of time you spend in the department is approximately 20 minutes, and your total radiation course may last from 1 to 9 weeks. For some patients, it is necessary to image the area treated daily prior to delivering the radiation. This is performed on the treatment machine using one of two methods. The first method consists of taking x-rays and matching them to the treatment planning films. The second method consists of taking a limited CT scan of the area and matching it to the planning CT scan. Your physician will see you once a week during your treatment course. This will usually fall on the same day each week. These physician visits are called on-treatment visits and generally require a little more time than your regular treatment days. You may encounter side effects during your treatment, which should be brought to the attention of the nurse or physician. It is important that you use only medications or ointments that have been prescribed for you by your doctor. For example, special creams and dressings have been developed specifically for skin reactions that may result from radiation treatment. If your treatment involves your head and neck area or your gastrointestinal tract, you will receive educational materials regarding appropriate nutrition and the management of alterations in gastrointestinal function. Similarly, if you wish to receive information for various support groups or transportation services, the nurse can provide you with this information. You have completed your radiation treatment, and your oncologist will continue to follow your progress closely. Patients are usually seen 4 to 6 weeks following treatment or sooner if necessary. To ensure your continued health, Future follow-up visits will be scheduled every 3 to 6 months. It is important that you adhere to your follow-up appointment schedule and recovery instructions. Your radiation oncologist will also work with your primary physician to ensure the best possible outcome.